Michael Osterling here with Professor Meg Jordan. She is chair of the Integrative Health Studies Somatic Psychology and Human Sexuality programs at the California Institute of Integral Studies in San Francisco. She is a clinical medical anthropologist, RN specializing in integrative and collaborative practice models, a behavioral health specialist, certified health coach, and grant recipient from the Aetna Foundation to explore health coaching for underserved populations. She is also author of several books, including How to Be a Health Coach, an Integrative Wellness Approach, which I'm holding in my hands, The Fitness Instinct, and she's the founding editor of the American Fitness Magazine. How you doing, Meg?
I'm great. It's great to join you, Michael.
It's great to see you. It's been a long time since you've been on my show, so it's lots to catch up on. But before we catch up on a wide variety of activities you're involved in, including I want to hear more about what you're up to at CIS, you have some big news to share. So why don't we jump right into your big news?
Wonderful. This is historic news. It's very exciting to announce it on your podcast because I know you reach a lot of people who are health conscious, who are looking at ways to transform self and society. That's what I love about your podcast. I think that this news really hits people right in their lifestyle. I've been part of an executive committee, a team of 8 very dedicated individuals for, maybe it's 14 individuals, for about 6 years. It calls itself the Consortium. It's the National Consortium for Credentialing Health and Wellness Coaches. Many of us are educators and trainers, teaching health coaching. And what we've done is realize that there's such a variety of health coaches and backgrounds and training out there that we really needed a new national standard that the public could count on. So we have been developing what we call a national standard for certification. And just last year, this very prestigious 100-year-old organization that delivers the MD exam in all 50 states, including Puerto Rico, which is required for licensing of medical doctors in the U.S. It's called the National Board of Medical Examiners, NBME. It's based in Philadelphia. It's got about 400 PhD psychometricians that work there. They're always looking at exam test item validity and quality and consistency of the exam. Well, they contacted us, the Health Coach Consortium, and said, we're interested in putting forth a national certification for health coaching. What? Why would the MD organization want to certify health coaches, right? Well, it's kind of like everything that you and I have been preaching for 20, 30 years, which is healthy lifestyles. I think what's happened now is there is a sea change occurring, a real tipping point, to throw in one more jargon, of people realizing that if we are to get well, if we are to have actual health care reform in this country, we have to come into a sense of personal responsibility about our own lifestyle choices. And the National Academy of Medicine has decided that, the National Institute of Health has seen that, and now the National Board of Medical Examiners have said we have to look at how to help people facilitate lifestyle improvement and make better health choices. So they were going to roll out an exam with or without us. We decided to partner with them. Took about 9 months of negotiation and marriage to get this agreement in place, and it's a historic agreement, really historic in the sense that there will be a new national certification in 2017.
Okay.
For health and wellness coaches.
That's fantastic. So your organization partnered with this medical organization, 2017. You said that's pretty soon. That's pretty amazing that such a large, older institution is able to work with you so quickly to come up with the national standards within a year.
I know. Well, I guess we've both been working in our own little silos for a while because we have about 4 years ago done a huge job task analysis. We followed a very best practice process.
Cool. And
that means that you can't be a bunch of ivory tower professors like me saying, what should be on the national certification exam for health coaches? Instead, a best practice insists that you gather working health coaches, really good experienced ones. You gather about 12 to 15 of them and put them in one room for a whole weekend and you ask them, what is every single task you do as a health coach? That's called the job task analysis. And the exam actually flows from that.
Wow.
From that and a validated survey that then went out to tens of thousands of people, health coaches, saying, here's the list of 21 items that these health coaches say they do in the normal course of a coaching relationship. Maybe not every day, but somewhere within 6 to 12 weeks, they do these 21 tasks. They establish the agreement, they ask powerful questions, they secure trust and rapport, various tasks. So then it goes out to this survey of tens of thousands, and they have to rate it, saying, yeah, I do that frequently, and I believe it's important. So all of those surveys and everything get put in the mixer, and we actually develop then test questions that speak directly from that job task analysis. So it wouldn't be like, there's about 50 different training schools now throughout the country, everywhere from Mayo Clinic to Georgetown University to Monroe Community College to CIIS, California Institute of Integral Studies, Well Coaches, Real Balance, Duke University, University of Minnesota's Center for Spirituality and Healing. So all of these programs, they each graduate health coaches, but they have a different flavor, right? Some are going to be kind of fitness oriented, like your own SEAL Fit. Some are going to be much more nutrition oriented. But what is the actual standard? What minimum competency must they all meet in order to call themselves a nationally certified health coach? That's been an agonizing process. That's been sitting around a table with 14 experts rolling up their shirt sleeves saying, by God, they need to know this. And others saying, nonsense, they don't need to know that, they need to know this. And that's been a long time hashing it out, and continues to be. So we think there'll be, by mid to late 2017, there will be this first exam ready to roll out.
So you mentioned probably about half a dozen, a little bit more, institutions around this country, some very well known and prominent, and others, I know CIS, but it's different than a Duke, it's different than Minnesota. How are you getting these different institutions to buy into the fact that they might need to participate in, a national standards-based organization, and then develop their not necessarily change their curriculum, but modify the curriculum accordingly? How does that all work out?
This is what intrigues me most of all as a medical anthropologist. I study how disparate groups come together with a common aim, and all of the negotiated discourse that happens to get there. And some of it, sometimes you piss off some of the people and they leave the table. Others get the common good mission right from the onset, and they stick through it thick and thin. And we've had national summits and retreats, and we've had many times in these last 5.5, 6 years of coming together. And sometimes it's been a love fest, sometimes it's been a slug fest. It is not easy, but it's fascinating to see. And I'd love to do a functional MRI on some brains. I'd love to see what are these brains that are actually able to set aside personal agenda and go for the common good. And you in your what do you call it, transrational work?
Transpartisan.
Transpartisan work. This is the heart of who you are, Michael. Your functional MRI would light up both sides of your brain really well.
I appreciate that.
Not so much. Yeah.
Well, just for audience edification, you and I actually did, not on the transpartisan in terms of public policy, but you and I actually worked together in the transpartisan health and medical space in the 90s with the Health Medicine Forum, building bridges between disparate perspectives on health and wellness and stuff. Doctors and chiropractors and DOs and shamans and body workers and naturopaths.
Yes, indeed.
Yeah.
And I'm still doing that work. That's an ongoing ethnographic study that I do. Once every 2 years, I bring together a huge circle. They sit with a patient who has chronic complex conditions like fibromyalgia, migraines, everything. And they get to hear what would Ayurveda do, what would Chinese medicine do, what would chiropractic do. And if you get a cohesive team, they actually learn to say, I'm going to back off. My own discipline doesn't do much for this. But I understand that herbalists have a lot to contribute. And that's the sort of collegial camaraderie that can actually occur, but it is a hard-won process, really.
Loosening up the ego grip on it's my reality and the world must organize around the way I think about the world, huh? That's good.
Yeah.
That obviously some folks can loosen themselves up that way.
Oh, it's getting to a point now. I'm just such an old bitch. I won't work with anybody with some amount of emotional intelligence anymore. That is like the number one thing to come together in a group. You've got to have an ability to have said that self-awareness,
Yeah.
to manage your own emotions, and then to be able to manage emotional relationships with, that you're situated with. And thank you, Dr. Siegel, for all of the good work that he's done on that kind of integration. So I even teach interpersonal neurobiology now.
Oh, do you really?
CIIS.
Oh, nice.
Yeah,
Nice.
because between that and basic self-awareness and emotional self-regulation, it's just critical, I think, for either collaborative work like
Right.
this or for even health coaches. So our CIS health coaches have a big dose of that. They even learn the Enneagram. They learn
Oh,
everything
good.
to do that kind of self-excavation, self-inquiry.
Your national standards, you had mentioned offline that they're voluntary. So talk about the voluntary nature of them, what you're hoping to get as a result of people recognizing in the public sphere that they exist, but they're voluntary.
Yeah, exactly. It's not a mandatory national certification. It will be optional. It will be voluntary, and that's important to know. So people who are health coaches who've been out there for 20 years as a health coach, they may choose to go for this national certification or not. It's completely up to them. What it does do is give the public a gold standard to look at. It actually is a consistent and fair exam process. It is collaboratively driven. A national team of experts puts it together. It's based on this job task analysis, not just some airy-fairy thinking about what should be on the test. And I would say you can't have a mandatory exam unless every state licenses, and that's a state-by-state procedure that's long and arduous. I think we're decades from something like that. I look at the headaches that I'm going right now between clinical nutrition specialists just to be able to practice in various states
Right.
where the registered dietitians are fighting them state by state on who can call themselves a nutritionist. So that kind of turf warfare becomes a legislative process that we're steering clear of.
Good.
Right now, we're just raising the public awareness that, hello, there's going to be a national certification exam. Hallelujah. There are so many fly-by-night operations where you can go online and within 2 hours a health coach certification is sent to you. It's nonsense. People really do need to have a basic knowledge of anatomy and physiology, exercise science, good sound nutritional principles as well. Things that are incredible science that you would find at the CDC or NIH. Not so much the Department of Ag. I think they're just in bed too much with lobbying groups. Some nutritional information out there that's sound and peer-reviewed.
So we're talking about health coaches. Why don't we kind of dig down from the 30,000-foot view of you have this national certification? I think you said 2017 coming online. What is a health coach?
Early. They can probably register for the exam early in 2017.
Cool.
Yeah.
But what is a health coach? And you actually have a whole book.
How to be health coach. It's so sweet to hold up a book.
I'll keep it up.
It's very little at Amazon, and it's quite a minor bestseller right now because there's so many schools and training programs that use it. It's even used in China.
Nice.
So there's how to become one. Well, that book is based on a semester-long course, which is 15 weeks and it's 15 chapters. And it goes through all the various processes and steps. But I think the hardest folks to train, honestly, are doctors, nurses, and psychotherapists, clinicians, because they are so used to being the expert and having kind of that top-down expert delivery of information, things that I absolutely know that you need to know. And that's not the coach approach at all. The coach approach says, I'm going to partner with you. I believe that you are the expert in your own life, that the best solutions for you to follow through on are the ones deeply embedded within you. And I'm going to facilitate a process of self-discovery for you to evoke those best solutions and strategies out from you. And I'm going to be your guide, a promised, trusty alliance guide, helping you with a step-by-step strategy to achieve your desired outcomes. That, in a nutshell, is the coach approach. And it is for health educators, sometimes it's a 180-degree turnaround in mindset. And they have to resist the urge. If you know motivational interviewing at all, it's used a lot in coaching. And you resist that urge we call the righty reflex, well, that's not right answer. Here's the right answer. I'm going to show you what's right. The writing reflex. And you have to resist that a lot when you're learning how to be a coach.
I would.
Once it's under your skin, you love it.
Well, I was going to say, I think a lot of psychotherapists should also try to move away from that idea too. And probably doctors and nurses too. They can probably learn a lot from their own patients.
Oh, yeah. Even more so, doctors and nurses.
Yeah.
Absolutely.
Yeah.
Yeah.
In terms of health coaches, talk to me about like who. Obviously, they work with patients. What kind of health issues do they deal with? And if they're dealing with a health issue, do they also work with the medical team, the healthcare team? How do you imagine that to work, and how does that actually work in life?
So when it comes to working health coaches, I want you to think of two categories. There's the independent health coach who has to be very entrepreneurial, Michael. They have to really get out there and self-market themselves to take on individual clients. And then there's the health coach who works for an organization, be it a hospital, clinic. A lot of them work for chronic care management companies that are either owned by insurance companies or are independent. Red Brick, Vita, Lantern. Oh my gosh, there's getting to be a lot of them. Many of my graduates work at these places just to pay off their student loans for a while. The fees are, the pay scale is anywhere from about $30 an hour to $100 an hour. The coasts pay a little better. The middle of the country pays a little less. When they work at these chronic care management firms, they might have to talk to 20 patients in one day.
Wow.
And I know, and it's all through the phone or online. And you call, hello, it's 8 a.m., I'm checking in, I see I've got 20 patients to call today, I'm going to make my first call. It's a 73-year-old lady with chronic obstructive pulmonary disease, and I see the care plan before me, and I'm going to check in with Betty. Hi, Betty, how's your oxygen tank? Is it filled? How are you doing right now? What's your exercise like? Any dietary questions? Tell me about stress in your life. I know you had a lot going on last week. How's that working out for you? So it's this really friendly, supportive voice on the phone.
Nice.
That's helping people move towards better self-care and better management of whatever chronic ailments they're struggling with. And hopefully with the idea of decreasing hospital utilization, decreasing all that crazy turnaround of I just got discharged from the hospital, but I'm back in within 30 days because of pneumonia or whatever. So we're looking at this entire way of managing America's health through these supportive alliances that help people move into greater self-responsibility. And also, sometimes it's just down and out hard luck, too. Sometimes you're in an impoverished situation. I think we need to spread health coaching to Medicaid recipients, to all Medicare recipients. I think that I have a grant from Aetna Foundation to bring health coaching to underserved street-dwelling adults.
Really?
Which is, really amazing. We have, San Francisco, I don't know if you've been there lately, but it is such a tale of two cities. There's massive wealth and massive poverty. Side by side, there's, 3 Teslas at a stoplight with a guy with 2 shopping carts and stuff who's been living on the street for years. So it is a city of extremes. And I think that working to get our street addicts, so much oxycodone and heroin overuse, getting them into shelters, getting them into a better nutrition program, that's part of our work in health coaching on the street.
For your Aetna grant, are you primarily focused in San Francisco, or is it other cities as well?
Yeah, it's primarily in San Francisco. I'll be presenting the first stage results studies in August at an Integrative Medicine for the Underserved conference in Irvine in August. It's a great organization. It's called IAM4us.org.
Offline, could you send me some information? I'm actually doing some work here with a homeless men's shelter, Central Union Mission, and I'd love for them to know what you're up to and what your research finds. Yeah, it's very good. Good on you.
So health coaching, you remember when CAM first rolled out, Complementary Alternative Medicine? It was for people who reached into their pocket and paid for it themselves, right? So of course we're seeing that with health coaching too. But to get it out of the white, elite, affluent, educated crowd to all sectors of society, full width and breadth, it's going to require these kinds of proactive stances throughout society. Absolutely.
I know you're big as a medical anthropologist looking at, and I'll call it tribal, but group process, group orientation, tribal orientation, and I'm wondering, both in the way you teach at CIS in terms of your health coaching program and the way you think about things, do you also include like family members and members of religious communities? Like, is it a team approach that you think about in terms of the health coach not only working with an individual but also their network of networks or their family or various systems that we're enmeshed in to help support them in the lifestyle changes?
Well, it is. It didn't used to be. It was the whole onus for change was heavily laid on the shoulders of the individual. And as a medical anthropologist who studies the social determinants of health, I knew that that was baloney.
Right.
That you needed the entire cultural, social support in order to make positive change. And tobacco cessation is one of the prime examples. It was really hard to stop smoking when everybody around you smoked. When society kicked in with laws outlawing smoking in an airplane or in the workplace, it was a lot easier to quit as an individual. So the same thing is happening with coaching. If you want somebody to change their diet patterns, their activity patterns, well, you better enlist the part of the entire community. Are there walk paths? Are they well lit? Are there bike paths? Are there safe neighborhoods? Are there playgrounds with real basketball hoops, or is it vandalized? So how is the society in lockstep with this onus of personal responsibility for behavior change? I think that enlisting family is really important. If you're doing any kind of cross-cultural coaching, you have to have a cultural sensitivity. You have to understand the intersectionalities of racism and trauma in many, many groups of society right now, and understand that perhaps a closed-eyed, guided imagery process of my best possible self is not necessarily going to work for somebody who comes from a neighborhood where 8 out of 10 men are incarcerated, where there are fly-by bullets going through, and grandma was shot last week. So in that sense, building trust and rapport is not just a quick 1-2 step. It is a step in which I'm more sensitive to the fact that I'm sitting across from somebody who's carrying quite a bit of post-traumatic stress and may not want to close their eyes in a guided imagery with me. So we have to, that's a master level coach that I teach, though, that is open and aware of that kind of cultural humility and sensitivity to it, and what are more important and vital strategies to do in that moment.
I would imagine they'd have to be aware of like intergenerational trauma and epigenetics and all that kind of good stuff. So at CIS, at your master's levels, where you kind of do a deeper dive into these various aspects of health and wellness and communal perspective taking.
Yeah.
Nice.
And also, it's a slippery slope. We have to make sure they're not doing psychotherapy, but psychotherapy has never cornered the market on difficult emotions. Every single person out there bitches and moans and complains about some emotional state to their coworkers, their family, their friends, their spouse. We all talk about our emotions. So you're going to talk about your emotions with your coach, too. That's okay. When a person is dealing with heavy emotions, the coach does not have to say, whoa, stop, this is an issue for a therapist, I can't go there with you. That's kind of nonsense. So we show them how to navigate still things within a coach approach so that they can still practice positive psychology, hope, and self-efficacy. We can help bolster a growth mindset throughout the whole process instead of picking a childhood wound, going into the deep heart of trauma, and sitting in a place where a synapse is truly locked in and requires much more deeper emotional reconsolidation work that a therapist would be able to use with EMDR or with actually coaches are learning tapping too. Tapping is so useful for just bringing anxiety levels down. So it's interesting. I mean, I've got one paper written with John Livingston at Harvard now on what's the difference between coaching and psychotherapy, and I can share that with you.
Please, love to see that.
That too, because it's territory we're still charting.
Excellent. Well, you also run the somatics program, and you mentioned tapping and EMDR. What role does somatics play both in terms of touch and bodily experience and being embodied as human beings and such.
Yeah, I love a deep somatic approach even to coaching. Um, I sat with Don Hanlon Johnson, who's founder of our somatic psychology program at CIS, and he's written books on bone, breath, gesture, and he says, boy, for 30 years, the somatic practitioner was in the wilderness saying, you have to look at the body. And now all of psychotherapy looks at breath and self-regulation and body scan and ventral vagal tone and attunement, and so it's adopted many of the early work of somatic practitioners. But I'd say there's a new frontier too for somatic psychology of investigating more in-depth work with neuroscience, with dopamine reward system and anterior cingulate and insula and mirror neuron systems and everything we're finding in this decade of the brain, and how to apply all that good stuff right now in the moment with presence, with authenticity, with an emotional attunement with our client, whether it's a psychotherapy client or a coaching client. That same extraordinary rapport and presence is what we know hands down is where the real juice takes place. It doesn't matter if it's cognitive, behavioral, dialectical, or psychoanalytic. It's the quality of the relationship with the therapist or with the coach,
Right.
that makes the huge difference. So it's fun to watch these waves of new knowledge come in and how it affects the field. I think somatic psychology is well positioned to go forward with some new evolutionary thinking now, though, because everybody's adopted what it decided 20 years ago.
I was fortunate to study with Don a million years ago.
Yeah.
Oh yeah. I took quite a few classes in the somatics program before moving back to the East Coast. A great experience. So
It is, and it's
yeah.
really under your skin. You never leave it, Michael.
No.
Never leave it.
But I actually, since you brought up this kind of conversation, I have a question for you, because this is what when I do my coaching and give talks about some of these issues, I'll say, people say, well, should I just see a cognitive behavioral therapist? I say, cognitive behavioral therapy is really good if it's kind of, if it's the scripting that's off and you can just learn to think differently. But a lot of people's wounds are pre-verbal before they have the ability to create a mental self-sense. 1, 2, 3, 4, maybe 5, 6, 7 years old, depending on where they're at in their development and their mental self started creating. If their injury is pre that, their injury is, then their symptomology might be in the way they think, but it's more of a deeper down thing. It's a somatic thing. It's a nervous system thing. And just changing your thinking is not going to necessarily change how you experience and express yourself in the world. You're the expert on this, so now I'm going to ask you, am I right? What are your thoughts on that?
I think you are right. I think there's that's the first of two good reasons to wonder if cognitive restructuring is for you. And the first one is just what you said, that a lot of wounding is pre-verbal, happens in a pre-verbal state. And sometimes the restructuring of language is not enough to clear up the contamination. I think that that if it is a matter of faulty thinking and you do arise at a less distorted way of thinking and expressing, you get a lot done. But I also have found that I've worked a long time with cognitive work of people, and they have recognized their faulty thinking and said to me, I know it's not right to think this way, but I still feel this way. Right, you still feel this way,
Yeah.
because the feeling is underlying. And
Yeah.
This is some of our new work with, not everything is top down. Some stuff is subcortical up. It's coming from the body and sensations and the gut and the immune system and everything else. All of this is feeding it in an upward flow towards the higher executive power. So they say, yes, I've cleaned up my executive function up here and the cortical reasoning, but that deep down feeling is still emerging and expressing from the tissues.
Right, and
so
yeah.
we're looking at top down and bottom up, two different flows of information processing in the body.
Nice.
And it's that old argument, that we used to have years ago. We used to always say, first you have the thought, and the thought gives rise to a feeling, and the feeling gives rise to behavior, which gives rise to bad thoughts or feelings. We're questioning that whole diagram now. sometimes we're finding out that the brain just has an urge long before there's even a thought.
And it's probably driven by the microbiome.
My God, it's the bacteria. They're in charge.
That's right.
We're just a hitchhiking post.
We think we have will. We have no agency.
100 million bacteria in charge. Yeah.
Well, this is great. So, a couple things. You mentioned the organization that you work with for many years that's now partnered with the Doctors Organization. What's the name of that organization and where can people learn more about it? This is my first question for you.
It's such a horrible long name. Here it is. National Consortium for Health and Wellness Coaching. NCCHWC.org.
Yeah, we'll have to work on that one.
Yeah, I call it the consortium.
Consortium. And if they go to that website, they'll be able to find out more about the national standards and the test and keep abreast of it as it unfolds and is released and stuff.
Oh yes, right on the front page now is the press release of everything I just talked about. And they can go over to credentials and they look at individual as an individual, what's it going to take for them to be eligible to sit for the test. If they graduated from one of these 50 schools that are listed on that website, they're pretty much ready to go sit for the test. If they haven't, what can they do to prepare for that? You know, do they need some mentoring? Do they need to scramble and go get some training? So they'll get all the information they need right there.
Excellent. So that's my first question. Second one is you're chair of a few different programs at the California Institute of Integral Studies. Can you tell us a little bit about each of the programs and where we can find out more information? And while you're doing that, I'm going to turn my light back on.
I thought I saw a little blink action there. So let's see. I'm an administrative chair of 3 different departments, and my heart is really with the integrative health one. That's where I'm a professor, and that's a 2-year program. It's a master's in integrative health, and it has embedded within it a certificate in integrative health coaching, and one in wellness management too. They also learn how to design and implement wellness programming for large corporations and organizations. And they also have a certificate in guided imagery.
Oh, nice.
Leslie Davenport teaches there. They really learn transformative imagery process. It's a great program. I've been there since 2008, and our graduates are true leaders in this field, doing extraordinary work. The other program is the long-standing, one of the first in the country, somatic psychology. It's a master's in counseling psych, and robust program, really full enrollment, and you know, it's long. It's 60 units in 3 years, and of course then the meter runs while they get their marriage and family therapist, and that can be another 5 years depending how quickly they get clients and gather their 3,000 hours, and then they're licensed as marriage family therapists like yourself. And then the third program is our new PhD in human sexuality. In San Francisco, it made sense to be a real epicenter of excellence in sexual health and sexual literacy. And both clinicians who want to say, you know, I just never got enough training in sexual education and sexual counseling. They come back to school to earn this PhD. Or we get administrators and city planners and people who say, I need our city to be a lot friendlier LGBTQ.
Okay.
Or we get women's health advocates who say, I've got to protect reproductive freedoms for women in this country. They're getting whittled away. A lot of people who are just coming in to say, we live in such a sexually negative country. We have these hyper masculinized, hyper feminized X-Men movies and stuff, and we have women thrusting and having pretend orgasms. We have just a nonsense view of sexual health and literacy. And how do we actually work to advocate for something a lot healthier and a lot less prejudicial, a lot greater tolerance for this sexual diversity that exists? So that's an extraordinary PhD program.
Great.
I think only 1 of 2 in the country.
And where can we find out more information in terms of a website for California Institute for Integral Studies?
Yeah, that's just our plain old website that's very mobile phone friendly now. CIISEDU. There you go.
All right.
CIIS.org. global.edu.
And how about for you? Are you still doing Global Medicine Hunter? Is that kept up to date?
Yeah, but I don't do it on TV anymore, and I'm too busy to do radio. But I do Global Health Hunter News, Global Medicine Hunter News. Sometimes I'll do releases, and then, I'm a professor now. I can't be the wacko I used to be. To be a grown up.
That's no fun.
Really sad.
Oh my God, that's funny. Well, Dr. Meg Jordan, congratulations on the national standards and the program emerging in 2017 for health coaches.
Thank you. It's so great to talk about it with you because you have such a good depth of understanding of what it takes and innate capacity to heal and grow.
Thank you. And it's great to talk to you again. It's been too many years. And hopefully we can both have you back on to more conversations about other aspects of your work. And then I'd love to talk to you offline as well, because it's always fun to catch up.
Well, Michael, send me the link for everything. I have a big network. I will get out more word on your podcast as well and on this show. And I think you'll have a lot of listeners for this one. It's a big announcement. So
Awesome.
thank you.
Thanks, Meg.
Take care.
Bye-bye.
All right.